So what we're going to do next is we're going to do the Ask the Doc segment, or Ask the Doctors segment. So the question we got, that's a common one, man. I think this is probably, I do a lot with extremities, so I don't think it's the most common thing that comes in, but probably a typical chiropractor outside of you and I with the fitness stuff. This is probably the most common thing they treat. And they said, how do I stretch my sciatic nerve? Was the way the question was worded. We have to, both Jim and I chuckled about that because you don't stretch nerves. All right. nerves hate being stretched. So
Ouch.
yeah, it's a bad thing. They don't like tension. Nerves are meant to have slack, and that's when they function the best. So I almost said function optimally, but it's just, again,
Can use
it is
that as a default.
exactly.
It's always safe.
But I think what the person who asked the question really meant was, what can I do with my body when I feel that pain down the back of the leg, which most people describe as sciatica? And I think that when we discuss the answer to this, first off, there's many, many, many answers. Okay. But we have to get a little bit into the anatomy and how that works um, as far as what we're targeting. But what we also need to be aware of is that sciatica, true sciatica, is one thing, but doctors frequently, outside of chiropractors, will frequently use the term sciatica to describe any pain down the leg, and it's really incorrect. It's really a misnomer, and it can be problematic because patients will come in and they say I have sciatica, and we see them in 5 seconds. Like, you don't have sciatica, but it's not all the same. It's just a very generic term, just like headache. Okay, if I walked in and I said I have a headache, well, what kind of headache do you have? There's 20 different types of headaches, and 100 different reasons you can have that headache. Sciatica is much of the same. So to dispel that myth, not all sciatica is the same. And then let's talk a little bit about the anatomy.
Sure. So we're going to put a graphic up and there'll be a video to follow just to kind of help you guys who aren't familiar with the body understand the sciatic nerve and then its surrounding layout in relationship to the muscles around the area. So for those of you who don't know what sciatica is, it's something that someone could feel. Let's go with what someone could feel, because who cares what you call it, right? It's just something that somebody puts in a textbook that describes what you're feeling. So the term sciatica, a lot of people will say, I have this pain that starts in my lower back, radiates maybe down to my glute, the back of my leg. So it could be along the hamstring line, which we'll see how that's commonly misdiagnosed, but it could be something that deals with the hamstring. Maybe stops behind the knee, and then could it continue all the way down to the bottom of the lower leg and then the foot. So there's all different degrees of what could be deemed as sciatica. That's why it's always helpful when someone comes in, like, show me where your pain is. Don't just call it whatever maybe someone else misdiagnosed it as. Show me where your pain is. When it comes to the anatomy, as the sciatic nerve makes its way through the pelvis and the hip relationship, there's muscles there. The most common one that I think a lot of people will know here, as we say it, is the piriformis muscle. It's piriformis. It's part of the external rotator groups of the hip muscles there. Fun fact, the sciatic nerve lies underneath that muscle in 80% of the population, but we've been, I guess you wouldn't know this until you're a cadaver, and by that time it's too late. But in about 20% of the population, the sciatic nerve actually pierces and grows through the piriformis muscle. So this is one muscle that we want to make sure we check, or that you get checked, to make sure that you're not getting compression happening all the way down to the hip, because then it's not a lower back issue, it's actually a hip issue.
Right.
And we need to address the gluteal group and the pelvic imbalance. So there's such a great relationship that I see in the clinic, and I'm sure you do too, Craig, where it's the pelvis hip relationship to really truly fix somebody who comes in with a presentation like that. And I think that is so powerful for the patient to know, because if we can diagnose it as being more piriformis syndrome than sciatica, than true sciatica, well then shoot, you send them home with a few stretches and a few mobility drills, and if they can keep up with that daily, you might hold your adjustment better, and then the pain can alleviate and heal. Nerve pressure, nerve irritation takes a while to heal, so we gotta be patient with this. And if you aren't diagnosed correctly, you could be getting the wrong homework, and then you're just creating more and more pain over and over again. So there are a few muscles that we'll show you on a graphic there, but the common one there is the piriformis muscle.
Good. Yep. And I think that here would be a good topic of how nerves work. Okay, so with nerve compression, there's a couple different stages. So I always use the water hose analogy, and if your nerve was a water hose and you were squeezing on a little bit and you're the dude at the other end of the hose spraying it, it's really annoying. It's irritating because you don't have enough water pressure, right? So that's pain. Okay, so slight compression is usually experienced in the body as pain. The next level up, maybe I'm stepping pretty hard on that hose, and it's like trickling out at the other end, like that is like pins and needles. Okay, so that limb falling asleep sensation, and last, total compression, like all right, that hose is all the way kinked. We're numb.
Numbness.
Okay, and I think that people sometimes forget that numbness is far worse of a situation than pins and needles or pain. And as we correct things, there's some retracing that may happen. So if you come in with, pins and needles, you're like, wow, I'm doing like way worse now because my leg hurts. I'm like, no, that's actually better. And conversely, if you're doing something and you're like, oh, I don't have any more pain, it's numb, but I don't have any more pain, we got a problem.
Wrong way.
So, yeah, wrong direction. So
it's a great teaching point.
Yeah.
And I don't think that's another thing that I see a lot of folks coming in. There's poor communication between the patient and the physician on like laying something out like that, like a timeline of, hey, as this gets better, it might actually seem like it's getting worse, but it's retracing back to health or the optimal function. Hello. So where do you want to go from here with it? So
well, what we're going to do is we are going to do a little video. Okay, so we'll insert this for our people who are following on YouTube. We're going to give a link below and you can check that out. And then in regards to, for our audio listeners, we're going to encourage you to go to our YouTube. Just search Optimal Function, which is FNXN. Okay, and then you can see that in the title of the podcast, but just to be clear, search Optimal Function. And you can see the video that we're going to talk about how to do some of these mobilizations and some stretches, and a big difference of explaining the difference between sometimes that muscle is shortened and it needs stretched, other times that muscle is tight and it needs relaxed, and there's two separate things that we're going to work with. And sometimes joints are just, they're freaking stuck, right? So then they might need an adjustment. Well, we're not going to give you the how to adjust part of that, but we will give you some mobility things to make sure that the hip, the pelvis, and the sometimes even the knee and ankle, sometimes those aren't moving the way they should be, and that will all be beneficial. So the short answer, I think, is you got to get it moving. You got to get that piriformis calmed down. And then finally, if anything you're trying, whether it be watching from us, watching other videos, talking to a physical therapist, chiropractor, doctor, MD, surgeon, I don't care. If you're talking to somebody and you're going in the wrong direction, probably then you need to get some imaging, because like we talked about, sometimes sciatica is confused with other things. And some of those other things can be a disc herniation up higher. And sometimes it could be a cyst on the nerve. And sometimes, we're great. Like, I think I can legitimately say chiropractors are great at what we do. A little biased, but I think Jim and I are really good at what we do. I can't take a cyst off of your nerve, right? So we need to know what we're dealing with. And if you're going the wrong direction with something that we're telling you or with something another doctor is telling you, you need to go and explore further. And don't just listen to one person, okay? If I'm not helping you, don't question chiropractic. You may want to just question me and then check somebody else. Like, go see Jim. Maybe he's got something else to offer you. But at a certain point, if you're not getting better, then you're going to have to demand getting some additional imaging.
No doubt. Yeah, I love that. The other thing too we don't want to ignore is this was us focusing on the sciatic nerve being pressured at the hip.
Correct.
So just to make sure we've given you kind of, let's just say that the hip version, the piriformis syndrome, is a lot easier for you guys to watch us show you a few tips. You try them. Don't just try them for one night. Try them for a week, for a month. And then subjectively check and see if you feel like you're getting better. By better, decreasing pain, increasing range of motion, not noticing the gait being as restricted, whatever it might be for you guys. But now if it is coming from north, up into the lower back, the discs having, some type of radiation going down the legs, radicular symptoms, we'll make sure that we get that looked at. So you know, we're fortunate enough to work on each other, weekly, if not bi-weekly, and getting pressure off our spines, because when we're bent over the table all day long, we can feel these symptoms. And
Yeah.
sometimes it isn't just at the hip, it is something that we need realigned in the spine. But when you get pressure off it at the spine, and that was the true source of it, man, there's nothing better than feeling
Oh,
that pressure off the back. So
absolutely.
make sure you guys go experience one more, time. Go check into someone who's local to you guys. Go get a chiropractor on your healthcare team, because if you can start to find that these adjustments benefit you, maybe it's the missing link that you've needed all along.
Yeah.